I'm worried about side effects.
Every medication has side effects. We're fortunate now that it's no longer, when we're treating opioid disorder, just methadone. There's a whole continuum of options. So that should be reassuring both to prescribers and to patients, because if something like methadone has intolerable side effects, and some people do experience fatigue, nausea with that medication, then there are now alternatives. With the medications that we offer, the common side effects are sort of pins and needles or itch or some local histamine reactions. Usually those can be managed just locally and with a cool cloth, or the symptoms will pass. But sometimes people do need a switch from hydromorphone and then maybe try acetaminophen. But again, we can reassure people these are the anticipated side effects, and we can try and manage those. And if not, well, there's other things that we can try. Another common side effect with all opioids is constipation. And patients may not volunteer that information or be comfortable disclosing it. So we as a team, whether it's nurse or the prescribers, need to be proactive, saying we need to watch out for constipation.